Welcome to GW Hospital's COVID-19 Vaccine Ready Town Hall. I'm Dr. Joseph Keith Melancon, Chief of the GW Transplant Institute and Professor of Surgery at the George Washington University Hospital. And I am so happy to be here alongside the great Dr. Gigi El-Bayoumi, Professor of Medicine at the GW School of Medicine and Health Sciences, and founding director of the Rodham Institute.
Why, thank you, Dr. Melancon. It's always a pleasure. In this town hall, we discuss the importance of getting the COVID-19 vaccine, access to the vaccine, dispelling misinformation, and why it's crucial for the Black and Brown communities to receive it.
In this program, Dr. El-Bayoumi and myself will be joined by emergency medicine specialist Dr. Melissa Clarke and Reverend Dr. Curry, pastor of DC's Pennsylvania Avenue Baptist Church.
In the midst of the COVID-19 pandemic, George Washington University's Rodham Institute has partnered with health, academic, civil rights, and faith organizations as part of the Black Coalition Against COVID-19. The coalition was established by Dr. Reed Tuckson, who was a former DC Health Commissioner during the time of AIDS, and Mr. Ambrose Lane Jr., who was the founder of the DC Healthcare Alliance Network, which represents and advocates for DC's wards 5, 7, and 8. The disproportionate death rate among African Americans as well as other underserved communities prompted the creation of BCAC.
The Black Coalition Against COVID-19 is dedicated to educating the Black community and all of its sub-communities, including young people, the elderly, the LGBTQ community, the homeless, and returning citizens. Black people account for 25% of those who have tested positive and 39% of COVID-related deaths. There are many reasons for this: pre-existing health conditions, lack of access to adequate health care, and other socioeconomic factors. And this spans across to our Latinx community as well. To talk more about these issues with us and the importance of the COVID-19 vaccines, we are pleased to welcome Dr. Melissa Clarke and Reverend Kendrick Curry to the conversation.
Hello, welcome. It's nice to see you both, Dr. Clarke and Dr. Reverend Curry. Welcome.
Welcome, guys.
Thank you.
Thank you so much. Pleased to be here.
Great.
Yes, excited.
Well, Dr. Clarke, I wanted to start off with you. Can you break down the differences between the current vaccines that are now available in the United States?
Let's talk about and remind everybody what vaccines do. They actually teach our bodies how to respond to the coronavirus or whatever particular agent the vaccine is working against. And in order to do so, these three vaccines use the genetic material of the virus. Now, the genetic material of the virus is something that we're all exposed to anytime we get a viral infection. So it's nothing new to our bodies. In this case, with the coronavirus, they take just the genetic material that teaches our body how to make the spike protein. The spike protein then triggers a response from our immune system once our bodies make it, so that it's essentially teaching our bodies how to respond when the real coronavirus actually invades our body. Hopefully that won't happen, but that's what the vaccine prepares us for.
So, Dr. Clarke, what's some of the misinformation you're seeing around the COVID-19 vaccines?
A lot of it, Dr. Melancon, comes from that concept of the genetic material. That's scary to some people, and which is why I always emphasize that anytime we get a viral infection, whether it be a cold or the flu, we're exposed to virus genetic material. And so with the COVID-19 vaccines, use of that genetic material, it's no different. It does not alter our DNA, which is a biggie. In terms of people's concerns. It doesn't give us COVID because it only uses a very small amount of that material that's specifically for the spike protein, so it can't give us the actual infection. And then the third big one that I have heard in terms of misinformation is that the vaccine can make you sterile. Well, we know that there were actually 23 women in the trials who got pregnant after they had taken the vaccination. And the other beautiful thing about this is that genetic material, once it enters your body, as soon as your body kind of gets those instructions, it destroys within minutes that genetic material. So it has no opportunity to make you sterile or alter your DNA or any of the other scary things that are circulating about the vaccines.
I keep hearing or seeing on the internet that Bill Gates and Microsoft will be able to track us through the viral material, the DNA material. I mean, why do you think that stays on the internet for so long?
I think with all disinformation, it takes root in people and in communities who feel disempowered. And therefore, whatever the misinformation is, if it sort of helps them gain a little bit of agency back in their lives because they then can get an understanding of this huge event that's very overwhelming. That's why I think disinformation takes root in a pandemic. And then when you talk to communities of color, especially that have been marginalized and don't have the access to a physician to whom they can talk to and bounce these ideas off of, and the social media that's gone sort of unopposed for really years around vaccinations, then you can kind of understand this perfect storm as to why those kinds of things linger on. Disinformation is also really based on a kernel of truth. So there's a clip of Bill Gates talking about, population measures, and he mentions vaccines. Well, the reason why that's important is because we see that when people are healthier, they make choices about not having large families, because in situations where infant mortality is really high, then people feel the need to have a lot of children because unfortunately they know that they're going to die from preventable diseases. But when we vaccinate and people are sure that their children are going to live to adulthood, they make the choices to not have as many children. And that's the
Interesting.
only connection between depopulation myths and vaccinations.
I would just also add that people say that they may be tracked. I say, well, what do you think your phone and Google and all these other
Exactly.
things
Right,
do?
exactly.
They're really
That's right.
already being tracked.
Yeah.
So, yeah.
Right.
Reverend Curry, we're seeing lower vaccination rates in DC's Ward 7 and 8. Why do you think that is?
Thank you for the question. There are many reasons. One of the main reasons is we have lack of access in these particular areas of Ward 7 and 8. And when I look at the uptake numbers, we're finding that there are so many that don't even know about the first of all the vaccine, and they also don't know about the virus. So the access to credible information is something that is very much lacking. And when we go further, we often see that part of that's related to, in the case of seniors and others, the digital divide. There are so many that just don't have internet where we are. They, even if they use their phones, that can be a pro and a con. It's a pro in the sense that they can look up things on the internet. It's a con in the sense that it is not something that they would ever be able to really talk about in terms of credible information that they're relying on. And then, quite frankly, there are some that just don't have internet at all. I've talked to many seniors who find themselves really just not even understanding, how to get on the internet. They don't have email. And so that is really limits access. If we were to go further, we even find that there's somewhat of complication with regard to registration, even if they can go on to the system. When they start to read all of the instructions and get to things done that they need to have done, it takes them a very long time. And there's great frustration because they don't find themselves able to find an appointment. Or if they do finally get into the system, they have to wait eons and long periods of time before they're able to find an appointment to get a vaccination. To go further, there are those who are in housing developments or housing areas that find themselves immobilized. They, due to a variety of factors, including obesity, and there's no real means of getting them out via transportation to one of the vaccination sites. So what do they do? Likewise, there are, before we started having faith in the vaccine and doing vaccinations at the church, there was transportation issues with regard to making sure that folk had access. I know folk that have literally, before the last several weeks, had to catch 2 and 3 buses to literally get to the vaccination locations where they found themselves. So we're dealing with a whole host of issues. The last one I will mention is just the miseducation that ties into what you've already talked about. And that miseducation, it creates a lot of vaccine hesitancy. And it is a great disservice to our community because people believe the lie as opposed to what the facts have to say. And that in and of itself is a very important factor in terms of making sure that folks stay away. But I'm proud to say that through a number of different things, including webinars and other things, we're seeing greater uh, amounts of numbers of people who find themselves engaged and desirous of having the vaccine.
Well, one of the misconceptions is that the African American community is one monolithic community. We know, for example, that through the work of the Black Coalition Against COVID, of which yourself, myself, and Dr. Clarke are all members of the steering committee, has actually shown that the needle has moved and people who are seniors are much more likely to take the vaccine. The challenge is in people between the ages of 18 and 40. So I think that's why it's also important to have messaging that really targets the people that are reluctant or have more questions. Yet another recent study showed that one of the primary reasons people are reluctant or hesitant is because they don't have enough information. And so that's why it's so important to have sessions such as we're having right now. But you brought up health literacy, which I know is something that Dr. Clarke does a lot of work on. Of course, there's even computer literacy. But one of the points that I don't think gets enough sort of attention is this notion of competing priorities. When you're a parent and you've got, some of your kids that may be getting schooled in digital, online virtually, and you maybe have one computer. Let's say that you're lucky enough to have internet and you've got 3 kids, or you've got multi-generational families, or you've got 2 or 3 jobs, or you have to worry about putting food on the table. Those competing priorities also are a barrier to thinking, even thinking and considering the vaccine. Yeah. So I want to go back to you, Dr. Clarke, and let me ask you about that health literacy piece.
Well, I think your point is excellent, Gigi, about Dr. Gigi, about the competing needs. I think we see that in health-seeking behavior in general, not just around the vaccine. If something is theoretical, that, oh, you could get COVID or you could get cancer, it's a very theoretical thing as compared to the need to put food on the table today. And so those communities for whom that is questionable as to whether they will be able to put food on the table today, health seeking behaviors become that much more remote and less important at the time. And then health literacy, too, is a barrier. Health literacy just speaks of the ability to understand health instructions and health related information and to be able to follow and execute on those instructions. And it's actually not even necessarily tied to educational level. We see even people who are well educated have difficulty sometimes because we as the medical profession don't make it easy for people to understand. We speak in coded terms. We speak down to people, unfortunately, a lot. And so that in and of itself is a barrier. So to the extent that we can make concepts understandable, I try to use a lot of analogies when I try to explain concepts that are difficult to understand. Like, for example, vaccination. I usually talk about it in terms of it's like you're going to get a pop quiz the next day, which is the equivalent of getting the coronavirus, and your body doesn't know, but the night before somebody gives you the answers to the pop quiz, that's the equivalent of the vaccine. And because we're homeschooling so much now, everybody that resonates with everybody, right?
Right.
Yes.
So I think it's really important that we as a profession really try to find ways to communicate more effectively with our patients. I think nurses and social workers, medical social workers, and others who work with patients do a much better job than we do. We need to really step up to the plate.
So, Reverend Curry, you have broken down these barriers by actually having vaccination events at your church. Can you tell us more about how that went and what are some of the lessons learned?
Yeah, well, it's been real exciting to be able to be among the first churches in the District of Columbia to really have vaccinations on site. One of the things that we have been able to do is to take down some of the barriers. I mentioned earlier about transportation being an issue. I mentioned uh, talked about health literacy and those who are immobilized. And one of the things we've been able to do is to work with the Department of Health as well as other partners, Five Medicine, Mary Center, etc., and be able to identify a stable supply of vaccine, where then we'll have a great vaccine administrator who will then do the vaccinations. And here's one thing that's very important. We made sure that the vaccine administrator looks like the people who they are vaccinating. So, in other words, they come from the community. It's a minority owned, Black owned business, and they're primarily vaccinating Black people. That's a major, major piece, and it creates a level of comfort like we've never had before with regard to just customer service and that adding that caring dimension. Hosting and holding the vaccination at the church is just another way that we can learn to care for our people. Our people are the oppressed, depressed, suppressed, and we find ourselves needing some additional care due to all of the trauma we find ourselves engaged in. Many come in with frustrated days, just trying to rush in and get an appointment. But we can help calm the spirit. And that's one of the things that we're very much focused on when we have vaccinations. And that's what's made it successful, because not only have we had great throughput, we can do well over 100 plus vaccinations a day based on the vaccine. We can even do more if we had more vaccine. But one of the greatest things is having a safe space where folk are cared for, and that caring dimension makes all the difference in the world. That's one of the greatest things we learned. We've also had people who have started our own local equivalent to Uber and Lyft, where we go by and we pick folk up so that they can make their appointments and meet their appointments. We just added something special to help with those who are dealing with social isolation, who are dealing with situations of immobility and have transportation problems. And during that time, one of the most uh, important things that we've done is really started showing some of the webinars again about the testing and about the vaccination that I've had privilege to do with you, Dr. Gigi, and you, Dr. Melancon, with Dr. Clarke participating as well. And that's very important. So in our observation room, after you've had the vaccine, or even when you're registering, we show videos to help continue to provide the education that's needed. Just think about this. We have videos that show the history and legacy of Dr. Kismekia Corbett. We show the other vaccine, what the importance of the vaccination really is. We show the difference between all of the three vaccines that have been rolled out. So you get to come and you have vaccination and a show as well. You can you can really watch something and learn something. See, just doing vaccinations alone is not the answer. It requires vaccination and continuous education that's going to help with this health literacy. And this is how the community helps find itself in a different situation, changing. And the more we can do this with credible messengers such as yourselves, not only getting vaccinated, but saying that the vaccination is safe and it's efficacious. And when we add to that, saying we're doing it in a safe space, a place where you're not bombarded with press, but you can come in and find somebody that you can ask literally. Some will say the dumb questions, or there are no really dumb questions, but those questions that are seemingly naive, folk get to ask those in a free environment.
You know, we talk about credible messengers, but who is more credible than your family member who may have gone to the church, felt cared about, learned more about COVID-19 and the vaccines, not just through the process, but through the videos, and then gone home and been able to talk to their family and they see, oh, my grandmother got vaccinated, my mother got vaccinated, my brother-in-law got vaccinated, and they're fine. And that, I think, is the greatest influencer that we've seen that has made vaccine hesitancy in the African American community swing from 60% down to about 30%, which is on par with the rest of the population.
Mhm.
It is that intimate contact with people who you know who've gotten vaccinated, I think, that's making a big
Well, and if
difference.
I'm going to also ask Dr. Melancon this, because both Dr. Melancon and I work and have worked and have the pleasure of visiting Pennsylvania Avenue Baptist Church. So this work that you are doing, Reverend Curry, first of all, it's not new. Your health ministry is very well developed. You
Thank you.
hold Alcoholics Anonymous meetings there. You have a day program. So
Mental
the
health, yep.
trust, the mental health, the trust that you have established, of course it makes sense that you're going to have a successful event. And so I think that when we partner, whether it's a public health or a clinical or health issue, with those trusted agents, be they faith-based or community-based organizations, that is the model. That's where we should start, right?
Absolutely. If I could just jump in, that is absolutely the model. And that's what's made it successful. Working with the Ron and Joy Paul Institute to do kidney screenings and kidney awareness programs, working with you, Dr. Gigi, not only just dealing with a mamma van coming and having cancer, but all of the things with regard to the Rodham Institute and through GW, and just making that happen. But the beauty of all of this, really, for me, is not only touching the people, but being able to do three things. We've had a substantive programming that we've developed over the years, but it's become scalable and it's also sustainable. So now we can have greater penetration depth into the community and see all of your programs come to pass. And it just makes sense as we talk about vaccine, but I can talk about the number of living donors as well with
Mm,
Dr.
Right.
Melancon,
mhm.
or I could talk about all of those other folk that have had the cancer treatments and other sorts of things with Dr. Gigi. So we've had a multiplier effect indeed, um, Dr. Melissa, and I am so grateful for this privileged opportunity to make this happen in DC.
Well, as you were going, I actually have personal information that you were offered a vaccine earlier. And I know
Yes.
you didn't want to do it then because you wanted to make sure that your church and the community had access. So I want to ask you, you and your wife being able to get vaccinated later when everyone else could be vaccinated, what sort of effect did that have? Did you find that that was part of this multiplier effect?
I absolutely. There were some folk in our congregation and in our neighborhood that said, Pastor Curry, because you were vaccinated, I can trust the system. I can see you point to its development. I can see you try to educate us. I've been listening to the webinars and it's made a difference. Thank you for having it, not only hosting it at your church, but being one of the leaders to step up and be vaccinated. And my wife has been vaccinated as well. And that is a ongoing and continuous thing that we must pay very, very close attention to. People listen to those who are in community. And I encourage everyone out there to get vaccinated today. Whether, no matter whether you're 16 or whether you're 80 plus, get vaccinated.
Okay, Dr. Clarke, this one is from Teresa Hicks. I have not qualified for the COVID vaccine in my area, but I just found out that I'm pregnant and now I qualify. Should I wait until a specific point in my pregnancy to get vaccinated, or can I sign up right now?
The effects of COVID-19 on a pregnant woman can potentially be very severe, leading up to hospitalization and even death and complications with the pregnancy. And so it's thought that the benefits of the vaccine far outweigh um, these potential issues related to the COVID-19 virus during pregnancy. I would talk with your OBGYN, talk with them about the ideal timing, but pregnancy is not a reason to not get the vaccine.
Okay, Dr. Clarke, this is another question. To follow up, can one drink alcohol a few hours after getting the vaccine? There seems to be a lot of communication on the internet about alcohol and the vaccine.
We know that alcohol has an effect on the immune system, especially in people who are binge drinkers and in individuals who drink every day, are chronic consumers of alcohol. It actually lowers the immune system because a lot of our immune system, believe it or not, lives in our gut, and alcohol can disrupt that. But the occasional drink here and there is, and in moderation, is how we basically should be living anyway if we do drink. And so it really is no different when it comes to time to get vaccinated. In moderation and occasionally here and there should not be a major issue around your body mounting an immune response to the vaccine.
Reverend Curry, I think there's another question. When the COVID-19 pandemic first hit, Sunday church days quickly pivoted to online services. How is the Pennsylvania Avenue Baptist Church creating a COVID-friendly safe space? And when do you think you're going to go back to in-person services?
Wow, big question. So, what we've done is to really take it slowly. And what we've done is really look at the science behind everything and listen to what our DC health officials and mayor have to say with regard to what we are doing in terms of meeting, in terms of occupancy. What we did initially was we've gone to online, Facebook, YouTube, all sorts of things. Even we've done Zoom as well as still conference call to keep our community together. And what we've done in terms of our building is to really set the path of having a program of series of protocols that would allow you to be your temperature to be taken, you to sign a waiver that you're entering and what have you at your own risk, and just notifying you of everything, giving you general information regarding the cleanliness of the building, and maintaining safe distance, physical distance from one another, and making sure that all of those boxes are checked with regard to one's health. And so that's what we've been doing. We have not fully gone back into the building right now. We anticipate that as things open up after later in the spring, early in the summer, is when we'll go back. We have not set a definitive time. We, anticipated time is probably around May, June before we do the go back, and perhaps even July. But those are the times that we're looking at.
I wanted to ask you a follow-up question because, especially at the beginning of the pandemic, there were so many people that were dying, and some of the statistics among African Americans in the United States overall is that it's estimated that 1 in 7 African Americans know somebody that's actually died, family member, friend. And of course, not being able to attend funerals and to grieve together. But how has the mental health of your parishioners, of your congregants, how have people been dealing with that, and what have you been doing to help them through these difficult times?
Yeah, we've done a number of different things. First of all, We have a partnership with MBI Health Services, and it treats DC residents, and they deal with mental health issues. You have everything from online group meetings, and they've even figured out ways of doing online art therapy, online Zumba classes, and all
You got
sorts
to
of
clear
other
the
things,
decks for that one.
other things that they've been able to do, so that they can, one, stay together and deal, because you don't want to add social isolation to anxiety disorder and depression and all of these others. So they're getting the treatment that they need. The other thing that we've looked at is having webinars of credible leaders, like yourselves, and bringing them together on webinars like Conversations with Dr. Gigi. and, and what we've been able to do is make sure that we've had those people who deal with all aspects of mental health, from those who are the practitioners that really are oriented toward, let's say yoga and all sorts of other things, to those who are really more clinical, and they're really doing the diagnosis and all of the other, so that people will have information. And we made this readily available so that you can get it on Facebook, so that you can see it on the internet. And we made it as digitally friendly as possible, where folk literally can pull it up on their cell phones. And that's very, very important. So we've been able to do that. Likewise, the last thing is that the church consistently has grief counseling that is made available to so many who have passed away. In fact, I just had a service yesterday, was another person that has passed due to COVID. So many that I have to go back and look at my book to see how many have passed away in this last year.
Well, thank you for answering that. That is a lot. 84% of the people who have lost their lives in Washington, D.C. have been African American. So that's been a disproportionate toll.
Yes.
Dr. Clarke, we have another question. With new variants of COVID emerging, when do you think we will have to get another round of vaccines?
Only time will tell. So far, it looks like against the UK variant that we've heard a lot about, that the vaccines are performing pretty well. A little less against the South African and the Brazilian variant. But in terms of whether we'll need new vaccines in the future, only time will tell. And the sooner we get vaccinated, which is the sooner that the viruses can't enter our body and make our bodies coronavirus factories, the fewer variations we'll get in the future. So that's why there's this urgency for everyone to get vaccinated, so that we can cut down on any new variants popping up that our vaccines may not perform well against.
Great, Dr. Clarke. You've given such great information to us today. I'm just wondering, how can we follow up? I hear you have a podcast. Can you tell us more about this?
Absolutely, yes. So it's called Excuse Me, Doctor, and it comes on every Monday night at 9 p.m. Eastern on YouTube and Facebook. And you can just go to those platforms and type in my name, Dr. Dr. Melissa, and then Clarke with an E on the end, and it'll pop up. We welcome questions. That's what we're there for. So we encourage people to type in their questions in the chat, and then we get to them as the show moves on. Welcome everybody to stop through. And again, you can find me on any of the social media platforms at that same name, Dr. Melissa Clarke, Clarke with an E.
Thank you, Dr. Clarke. It is such a pleasure. You know, I'm your biggest fan. Thanks for joining us tonight.
Thank you so much. It's a mutual fan fest. And as I always say to everyone at the end of my show, I say, be wise, be well, and be health empowered. So same to you and all your listening audience. Thanks so much for having me. Bye-bye.
Thank you.
Bye. Thank you to all of you for joining us in this special Vaccine Ready conversation. For more information on resources and the facts we spoke about today, visit gwdocs.com and blackcoalitionagainstcovid.org. Please continue to wear your mask, get vaccinated, and be safe. I got my vaccine. Dr. Melancon, did you?
I did, and you should get yours.